Welcome back to the Alpha Mega Biz Dev Podcast. I'm your host, Dr. John Lee, and if you're looking for small business tips, and in particular, chiropractic business tips, you are in the right place. And today's topic that we're going to dive into is spinal decompression therapy, the adjustment's best friend. So what I mean by that is if there were a service that just complemented the traditional chiropractic adjustment so well, I would say from experience, for having used decompression for years now, it is spinal decompression therapy. It is non-surgical spinal decompression therapy, and the two go together like burgers and fries. The synergy is just so good, right? They complement each other so well. So why is that? The reason why, and I still firmly believe that adjustments are probably the most important thing that we do as chiropractors, that we've gone to school for, that we've learned in school, the art and skill of adjusting that, only gets better as years go on and as you practice in your business with patient after patient. So still number one is going to be how we skillfully deliver adjustments. And if you're a chiropractor watching or listening, then you probably know very well that it truly is a skill and art that we have to get better at, work at, train on. And even after years and years, you can still get better. I've been 22 years in practice, and I still feel like every year I'm a little better than I was the last year. And I'm not sure if you ever feel it, but if you ever get in that zone of adjusting, like during peak hours when you're seeing a lot of people and you're pretty busy and you're seeing patient after patient, I tend to do the best with adjusting at that time. Kind of like how basketball players talk about being in the zone and they're hitting every single shot, things like that. So anyways, first I just want to establish, not trying to downplay adjustments at all. Still, the number one thing we can do. And also the beauty is you can deliver adjustments anywhere, right? I adjust my family at home all the time. All my family members, you can adjust people when you're out on vacation. I don't know how many times my family has asked me for adjustment at a restaurant, or we're out and about and they just lie down or sit down on a bench in a public area and I adjust them. So anyways, adjustments, number one, right? But the next best service that we can provide that's within our scope of practice of providing in services, it's got to be spinal decompression therapy. And there's two main objectives here. So the adjustment has an objective and goal or result, and that is correcting and reducing vertebral subluxations. So bones out of place in the spine primarily. We focus mainly on the spine. I know you can adjust extremities too, but our main thing that we do is we identify subluxations in the spine, and we know how to skillfully, accurately, effectively adjust those bones back towards their normal alignment to restore function, to eliminate pain, to restore proper nervous system communication through the spine. So that's what adjustments do. Now, that's because the spine is very, very apt to or likely to develop individual places of misalignments or subluxation. That's just the stress of life, right? Either through single traumatic events and injuries, falls, bumps, bruises, accidents, and also just the repetitive strain of life, doing things over and over that we do with work, with poor posture on computers, with lifting things too much, even raising kids. I know, myself being a father of four, ages 12 to 5 currently, I've done a lot of lifting of my kids and putting them into car seats and bending over the bathtub to give them a bath. Still doing that right now with my 5 and 4-year-old sons. And all that wear and tear, it wreaks havoc on your body, right? So all those things cause subluxations. So that's where the adjustments come in play. Now, what does decompression do? It decompresses areas of discompression or disc degeneration. There's also disc bulges. And, there's so many names for very similar things. So disc protrusions, disc herniations, disc extrusions. decompression therapy very effectively treats all that. And let's start with disc degeneration. So common, right? If you are a chiropractor who takes x-rays, which I know about half our profession does, half doesn't, and we do in my clinic as a standard for new patient care. If you have a lot of experience with x-rays in new patients, you know that the vast majority of patients that come to your office present with some level of disc degeneration, usually at least a phase 1 degeneration. So if you're familiar with the phases, there's normal full-size disc. Phase 1 degeneration means a little bit thinner than normal. Phase 2 is moderately thin, a lot thinner, with usually bone spurs or osteophyte formation around the lips of the vertebrae. And then phase 3 is bone on bone. Okay, so again, phase 1 is mild. Phase 2 can be considered moderate or severe, too severe, and phase 3 is the worst, is bone on bone. And so there's so many patients that come in to my clinic over the years where they have at least a phase 1 degeneration somewhere. Where are the most common areas? It's the low back at L5S1, right? It makes a lot of sense. It's the bottom disc that's supporting all the weight above, and it's the most common one to start to degenerate, to start to lose its natural hydration and to diminish in size. And also it's because L5 and the sacrum, S1, are very typical areas of subluxation because it's at the bottom of the spine. And if you know about spinal mechanics, you know that when there's a lack of motion, discs will degenerate a lot faster because proper motion needs to be around the disc for it to metabolize and be stimulated to get hydration in, nutrients in and out. It needs proper motion. So when you have an L5 and an S1 that are stuck or crooked out of place, that disc doesn't get a whole lot of movement around it, and lack of movement leads things to degenerate and die off, right? So that's why L5S1 is one of the most common areas to start to exhibit disc degeneration. And usually phase 1 you see a ton of. We see a ton of that with just general low back pain patients. In the neck, it's usually somewhere between C5, 6, and 7, lower half of the neck. A lot of weight and stress builds up there, especially because of forward head posture and reverse curve or straight necks in people's spine, in the neck not having that natural lordotic curve. So the bottom vertebrae or the discs of the neck tend to have all that load, and they tend to degenerate. Okay, and usually a lot of phase 1 we'll see in one and sometimes multiple disc areas. Then phase 2, we see a good amount as well. And those are problems that have been going on for longer, more chronic. There could have been a disc bulge or herniation to make this happen faster. And there's osteophyte formation or bones formation around these levels of the disc at the ridges of the vertebrae. So we see a good amount of that. And then every once in a while, we'll see a bone-on-bone phase 3 fusion. If I had to put a percentage on it, I say 80% of new patients that come into our office exhibit a phase 1 or phase 2 or combination of phase 1 phase 2 in their lumbar spine and their cervical spine. This is why decompression therapy is so valuable and essential to the general public, to people in your community, because it's such a common problem to occur to the human spine, is disc degeneration. So it's kind of like dental problems and going to your dentist, right? What are common problems for your teeth? It's cavities and it's buildup of tartar, right, and plaque. And so typically when you go see your dentist, they'll do a cleaning, they'll scrape all the tartar and buildup and plaque off your teeth, and they'll also identify any cavities and then make any recommendations and corrections to treat those cavities. So drilling them out, filling them, sometimes leads to more invasive things if the damage is too far gone. So just like, again, those dental procedures are very necessary for those very common dental problems that human beings just have because of life and eating and not the best dental hygiene sometimes. For the spine, we have very common problems as well, which are subluxations, misalignments, and also degeneration of the discs and also sometimes the surrounding bones. So that's why decompression is such a great complement to chiropractic adjustments. It really just rounds out everything. So adjustments gets bones back in place, gets bones moving properly again. It frees up stuck areas. In decompression, stretches out or tractions those areas of compression degeneration and gives that area a much better chance of restoration and returning back to normal function, releasing pressure off of nerves, allowing discs to actually stay healthier. And in my experience, I've seen a lot of post x-rays that we take where a disc does increase in size. It doesn't happen in all cases. If I had to guess, I'd say maybe about 30-40% of cases, you can see actual visual improvement in the disc size and height. And in the other cases, it doesn't, but the patient is functioning very well. They're out of pain, and we've been able to help the patient, even though there's not a noticeable increase in disc size. What we've helped with is preventing that disc from further degenerating in the future years. Okay, so it's this perfect 1-2 combo, right? Again, it's like burgers and fries, right? It's that perfect combination, and that's why for the past 5-6 years in my clinic, we heavily rely on decompression. Probably 80% of our new patients get recommended some amount of decompression therapy, usually 1 or 2 months. If it's the first month, they're coming in 3 times, so 12 visits on our lighter phase 1 disc problems with general neck pain, back pain, with no radiculopathy, no radiating pain down the arms, no paresthesias. Usually a month of decompression will get the job done. If there's a phase 2 disc degeneration and there's radiculopathy, that's when we'll recommend a second month of decompression. Usually by month 2, we're seeing patients twice a week, so that's an additional 8, so about 20 total. And on occasion, we might actually do a third month and add on more decompression if needed once we get to that end of the second month of their corrective treatment plan. Now, can you do other techniques like Cox flexion distraction technique? Yes, absolutely. And previous to us acquiring decompression table services in our office, that's what we did. And because in my early years, back in 2008, I didn't really have the funds to get really fancy treatment tables, such as automated Cox flexion distraction. I got manual ones. And so for years, I did manual flexion distraction technique, a lot of, labor, and I would sweat doing it. Probably led to some of my injuries I've had as a chiropractor. But decompression really allows us to not have to do Cox flexion distraction techniques anymore. Although now we do have automated, really nice hill tables that do automatic flexion distraction if we need to do that technique. But majority of low back disc cases, we actually use our decompression tables to do that very important work. Okay? Now, what types of decompression tables would I recommend if you're considering doing this? There's several out there. The one that we have in our clinic are the Chattanooga Triton DTS tables. And we have 5 of these in our clinic, and these are amazing. They are, in my opinion, priced just right. At the time of this video, they're about 14-15 grand per table, brand new, and does lumbar decompression and cervical decompression very, very well. Very capable in both areas. I know that some companies don't do very well with cervical, but Chattanooga does extremely well with their table on both cervical and lumbar. The other one that some clients of mine have is the DRX 9000. And this one, definitely a pricier table, pricier piece of equipment, very, very high-tech, fancy looking. It does a great job from what I hear. In my opinion, I think you can get it all done with the Chattanooga Triton DTS. But if you can afford the DRX 9000 and you want that fancy look and all the bells and whistles, then by all means. But I don't think it's absolutely necessary. I think you can get exactly what you need to get accomplished with the Chattanooga Triton tables. Okay? And I'm going to have just a quick image of the Chattanooga Triton DTS tables. And here's a quick look at the DRX 9000s. Okay. So is this worth it? Is it worth the investment financially? Is it worth taking the time to learn how to use these and really become experts at this, which you absolutely have to have that goal to become experts at providing these services at the highest level to your patients. You can't just get these for the sake of making more money in your clinic. That is the wrong motivating factor. So anyways, is this all worth it? Absolutely, right? Because first and foremost, clinically, is this an amazing tool that your patients in your community will benefit from? Are you able to help your patients even better by having decompression therapy complement the almighty chiropractic adjustment? 100%. No doubt about it. This helps the care to be at even higher quality levels. Is it worth the financial investment? Now, if you ask me, yes. If it's the Chattanooga Triton DTS tables, yes, absolutely, because you can make back the cost of one table very quickly. In my coaching program, it happens all the time. When I train one of my coaching docs to start decompression services in their office, they usually go get one. I always recommend just get one first to make sure you get comfortable with the table, learn it, spend about a month learning it and testing this on patients that are willing to give you honest feedback, basically give free services to get your bearings on how to use this table. And I kid you not, every single client, after about a month, they get to max capacity on the scheduling of that one decompression table, and they're they need to get a second table and maybe a third table. And that's what happened to us. We had one table. After 1 month, we were testing it. Then we started to charge for it. Couldn't schedule any more people on it. It was fully booked all day, all of our working days. So then we got a table number 2 and 3 right away. Then eventually got a 4th and 5th. And with 5 tables, we feel very comfortable with our scheduling capacity. So yeah, so that's what this episode is really about. Is really just to share from my practices experience, my firsthand experience, that it probably was one of the best additions we made to our clinic. A lot of credit goes to my associate doctor. He had experience with this prior to joining our practice, and really just piqued my interest. I had known about that Chattanooga Triton DTS table for quite a while. Was very intrigued, but then with him teaching me more about it, then I felt comfortable of actually pulling trigger and getting one of those, right? And it's been amazing ever since. And I almost forgot to address one other important point here, is that once we started decompression therapy in our office, we were able to cut down the number of chiropractic adjustments that we had to include in treatment plans. For example, we were doing typically 3-month treatment plans, seeing our patients 3 times a week, so 36 visits. We were able to get that down to 28 and 24 visits. So we saw that with the decompression, patients were getting better faster. So by the 2nd month, we were able to reduce down to 2 times a week, also into the 3rd month. And in some cases, we were able to reduce down to once a week by the 3rd month. And so gets patients better faster, and then ultimately less wear and tear physically on the chiropractor's body. So it has very likely given some longevity and a little more years to my career, to extend my career if I wanted to extend it. So that's the other huge benefit. It's going to lessen the physical load of the repetitive stress that being a chiropractor puts on us by having these therapies get patients better faster. Okay, so honestly, it's such a win-win. Okay, so if you are considering it, definitely go test it out first. Feel what it feels like. Try it on the lumbar spine, try on the cervical spine, and then talk to various chiropractors about the business aspect of it. And obviously, we're here at Alpha Mega Consulting to advise you if you'd like to learn more about this and know how to implement this properly within your practice. But there are other services, obviously, that I've mentioned in previous episodes, and we're going to get a little bit deeper in future episodes. But the first addition that you should consider if you don't have other services, I would say decompression therapy. Okay, it's a no-brainer. Takes care of the compressive load problems that happen to the human spine on a regular basis. So adjustments, decompression, perfect synergy, perfect partnership, happy patients, thriving business. All right, guys. So I'll leave you with that, and please check back, and we'll be back with more tips and strategies on chiropractic business growth, helping you get to your dream practice. And if you eventually want to work less, part-time, half days like I do, while having a very profitable practice, that is an ultimate goal that we have for all of our clients. Check back soon for more episodes. Dr. John Lee with the Alpha Omega Biz Dev Podcast.